Hey there, it's Eileen, and I have a quick announcement for all of you professionals out there. The fall cohort of the Think Brain First certificate program, that's my training program specifically for professionals, it is now open for enrollment. This is our second cohort. I had so much fun with our first cohort. It was wonderful, and I cannot wait to get started with the second cohort starting October 10th. This is a multi-day intensive training and consultation program. It's designed for professionals and organizations who serve individuals and their families impacted by brain-based differences and challenging behavioral symptoms. Here's what I know to be true without any sort of doubt, is that families need professionals like you who understand them from a brain first lens. I hear from these families every single day telling me their own personal story that reflects this need. That is why I created this program. And here's the other truth and the other reason this program exists. We need you doing your very important work in this world with these complex kids and their families. And we need you to not be experiencing burnout as a result of that. The Think Brain First certificate program will help you transform the way you understand and support your most complex clients and their families so that you actually look forward to your work with them and you feel confident that you know how to help them. This isn't a training that is only focused on acquiring knowledge, although there is plenty of that. It is just as much about integrating what you learn into your work with kids and parents and families. So to learn more and to secure your spot, simply go to thinkbrainfirst.com. Again, that's thinkbrainfirst.com. As I said, we begin October 10th, and I intentionally keep the cohort small so that we can focus in deep on every participant and their work and how to integrate this brain first approach into their specific work and setting. So if you know that you want to join this program, you will definitely want to secure your spot soon. I truly can't wait to spend this time with you and the other professionals who decide to join us and who are also engaging in this very important work in the world. Again, the link to learn more and enroll is thinkbrainfirst.com. Okay, now on to the episode. On today's episode, I have my dear friend and colleague, Wendy Sue Horn, as a guest so that she can share her knowledge and her brilliance with us. Wendy Sue and I met way back in 2021. We were both asked to teach a year-long postgraduate certificate program in adoption competent mental health services. And this is a program that is offered to clinicians throughout the state of Oregon, and it's a partnership between Oregon Department of Human Services in collaboration with CASE, the Center for Adoption Support and Education. So Wendy Sue and I started this with two other colleagues teaching this year-long course. We still teach this course together. We are actually about to start our 5th year of facilitating this program, and we have become good friends and colleagues in the process of doing so. Wendy Sue is a master clinician. She has worked with children and adolescents and adults for over 20 years, and she's an expert in many things, EMDR therapy, anxiety disorders, PTSD, complex trauma, dissociation, child development, and parent support. And she works with clients throughout the states of Oregon and also California. Wendy Sue has also been mentoring therapists in EMDR specifically for 10 plus years. She also partners with Oregon's Child Welfare Services, where she offers EMDR therapy, training, and consultation scholarships to therapists who are treating clients who need this powerful and integrative therapeutic approach. I was lucky enough to do my own EMDR training with Wendy Sue, and not only is she a warm and supportive teacher, she is natural. She was born to instruct and guide and mentor, and she's able to take really complex topics and break them down into very digestible pieces that make sense for her students as well as her clients. Her approach to working with all of her clients, but specifically parents, since that's what our podcast is all about, it's really practical, it's accessible, and that's why I really wanted to introduce her to you and have her come on the podcast today. Over the years that we've known each other, she and I have had many conversations about the experience of being a parent, especially the really hard experiences, and the way she sees this often complex child-parent relationship, especially when you have a child with intense needs and intense behaviors. What I've always loved about her approach and the way she sees this dynamic and the way she supports parents is that it is rooted in empathy, it is non-shaming, and it's also hopeful because it opens the door for healing. I'm so thrilled to be introducing Wendy Sue Horn to you today, and I'm excited for you to listen in on our conversation. With that, let's get on to the episode. Hi there, and welcome to the Brain First Parenting Podcast. I'm your host, Eileen Devine, and I am a therapist, parent coach, and educator who supports parents that are raising children, teens, and young adults with brain-based differences and challenging behavioral symptoms. If you are a parent or caregiver of a child who has intense, confusing, relentless, or sometimes even scary behaviors, you are in the right place, and I am so glad you're here. Let's get started. Hello, Wendy Sue. Welcome to the Brain First Parenting Podcast. Thank you for being one of my first guests.
I am so excited to be here.
Well, I am thrilled for our listeners to be able to listen to you talk about your depth of knowledge in terms of parent-child relationship and everything that's encompassed there. I've already given folks a more formal introduction to you so they know what work you do and your credentials and that sort of thing and how we know each other. But I would love for you to be able to add to that if you want, more informally. And I'm always curious about how people have come to the work that they feel so passionately about and why you feel so passionately about it. So if you want to share any of that, I'm sure our listeners would be curious to know more about that too.
Yeah, that's actually really fun to talk about, I think, because in my life, I feel like the way that I have been kind of won the lottery of life was that I knew what I wanted to do, I want to say, since I was 12. It is something that has truly felt like a calling. Like I used to answer my mom used to read me advice columns, and I would give my own advice before she would read me the advice from Dear Meg and Star Magazine.
Yeah. Oh,
And
I remember.
I think I was giving solid advice at like 8 years old. I'm not joking. So it's just how I've always moved through the world was in exactly the way that this work lets me. But then my mom ran a daycare from home and was just very engaged in the community, worked as the lunchtime yard duty, did some before and after care at my school. So raising kids was part of the culture of our family. Like I learned how to put a baby down for a nap and listen to different cries when I was like 4 or 5. My mom was talking to me like, do you hear that? That's the baby getting tired. He doesn't need us. And so like those little things were just woven in. And then clinically, I chose to be a social worker, partially to stay out of student debt when I looked at how much it would cost to be a psychologist. And then once I, was licensed and was practicing, was a nanny. That's how I paid for college. And I was doing child welfare social work at the same time. So I was having this very dichotomous experience of being in East Palo Alto, doing child welfare work, and then driving 3 blocks over near Mark Zuckerberg's house and next to Steve Jobs' house and working in people's homes and seeing pretty similar stuff, which was very interesting to me,
Oh, interesting.
in terms of how parents struggle to be with their kids and
Yeah.
without those other socioeconomic factors. So that kind of played into my practice, and I started working in community mental health after child welfare. And then this colleague at UCSF's high risk perinatal clinic, postpartum clinic, found
Mhm.
me at a networking event and didn't know anybody who was doing postpartum mental health and understood infants and babies and child development and
Hmm.
parent support and trauma. And so that pairing kind of led into my private practice in San Francisco, specializing in postpartum mental health and traumatic labor and delivery. Meanwhile, I was doing just straight trauma work with adults and children at this time. So the whole
Yeah.
thing became married. And
Yeah.
and then when my friend from grad school, April, funded the trauma and the training for adoption competence through CASE, she was like, "Oh,
Yeah.
you have all the trauma stuff and the parenting stuff. Come do this facilitation."
Yeah.
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 Yeah, and
Yeah,
then
it's
I
like all
landed here.
these what can feel in the moment like these random things happening, or I'm just trying to find a job. I'm just trying to find a I'm just helping my mom with what our family does, right? But then you can look back and see like, "Oh, no, it was all one path,
It
right?
was all
Leading to one
coming
path."
together.
Yeah.
Yeah, and, like,
Yeah.
what I had lived in my home and then finding clinical words for it, and then
Yeah.
being able to, have conversations like we're having today where we can take away all the clinical language and make that
Yeah.
understandable and relatable to parents as they're sitting in those
Yeah.
situations in their home, trying to
Yeah.
do their best with their kids.
Yeah. Well, that is exactly why I wanted to have you come on, because
Mhm.
over the last 5 years or so that I've known you, 4.5 years maybe, I've heard you talk about this many times in the trainings that I've done with you when we've co-presented, co-trained together. And I just think you have such a great way to take the science and these complicated topics and really make them very digestible
Mm,
for parents. And when I'm talking with parents about how they want to show up for their kids, and of course, their kids have very, very challenging behaviors,
mhm,
lots and lots of reasons why that's difficult. I'm always talking about we don't come into parenthood as blank slates. Like the
mhm,
way we were raised, our attachment with our primary caregivers, our family of origin, all of that matters. And it follows us forward into those relationships. And my reason for saying that over and over and over again is because the parents that I work with are working so, so, so hard to
mhm,
show up for their kids in this way that we talk about, but they have so much shame because they feel like
mm,
they can't do it, right?
mm.
Like they have the knowing, they can tell me outside of the challenging moment when we're meeting, like, yes, this is what was happening. I could see it now. This is how I want to be
Right.
next time this inevitably happens again, but I can't do it,
Yeah,
right? In the moment, I
yeah,
end up behaving in ways that I'm ashamed of, that are
right.
like lashing out or yelling, just behaving in ways that they regret
Mhm,
later.
mhm.
So I'm wondering if we can start there, and just any thoughts that you have on what I've just shared, what you've heard
Yeah.
parents talk about related to that.
Yeah. Oh my gosh. I just like to always ground this conversation in parenting is the hardest job. Even
Yeah.
if your child is neurotypical and
Yeah.
is pretty mild-mannered, it's just an incredibly heavy lift with high, high stakes and a lot of people watching, it feels like, as we
Mm.
do this thing that society doesn't compensate or recognize it being as difficult as it is. There's even, the term of like, "Oh, you just stay at home," is just,
Yeah.
and
Yeah.
so, yeah, I think that's why I became an EMDR therapist. If we just take it out of parenting for a second, we have all of this learning and knowing. We read parenting books, we talk and reflect on ourselves, and we learn our own story. And all of that is happening in the part of our brain that is wise and patient and empathic and can put things into words. And when we're activated and triggered by things, when we're too
Hmm.
tired or overstimulated or scared,
Hmm.
which parenting is very scary,
Yeah.
we can't access that part of our brain typically. And the more complex our childhood has been, and the more like aversive childhood experiences we've had, then the less access we're going to have to that in those moments when we're really activated. So whenever I'm talking to parents who are feeling badly, and when I'm talking to adult children that are reflecting on their parents,
Yeah.
I try to describe what it takes to meet your child's emotional needs, right? Which is
Yeah.
attunement, right? So
Yeah.
in order to develop and maintain and heal attachment, we
Yeah.
need to be able to attune to our kids and
Yeah.
understand what it is in that moment that they need.
Yeah.
And in order to do that, we have to have three things. We have to have awareness, motivation, and resource. And if we're missing one of those things, it's like a three-legged stool. Like you can't stand up without one of those legs.
Yes.
And
Yeah.
and what I see is I've rarely met a parent that doesn't have so much motivation, right? Their
Right.
heart is in the right place. They're filled with love. They want to do this. They are committed to their child. But how much awareness do they have of what it is their child needs at that moment,
Yes.
at that age? And what kind of resources do they have? Like, this is
Right.
the big piece.
Right.
Yes.
Internal and external, I
Exactly.
imagine. Yeah. Okay.
Internal and
Okay.
external. So how much
Okay.
time do you have? How much help do you have? How
Yeah.
isolated are you?
Yes.
Um, how was your sleep that night? What was your
Yeah.
nutrition like? I was just hangry with my daughter this morning, right? It was
Yeah.
under-resourced in terms of like my fuel. But then also, are you solo parenting? Do you have your own
Right.
trauma history? Do you have a model of how to meet people's emotional needs, right? Do you
Right.
have a
Right.
relationship with your own emotions? Like those are the internal resources
Right.
that we also
Okay.
need to have.
We I want to dive into all of those pieces.
Yeah.
So I think the first piece is to start with, you mentioned attunement.
Hmm.
And if you can describe a little bit for folks what exactly you mean by that, because I think that that might be a new term for some listeners.
Hmm.
And then other listeners might have heard it, but may not have exactly the right idea on what it is exactly. So, how would you describe it?
Yes. So before we talk about attunement, let's talk about mentalization. Okay.
Okay.
So, well, I'll just say attunement is your ability to be on the same wavelength. So tune in to
Hmm.
your child's what they're experiencing in that moment and to be on the same page, right?
Okay. Hmm.
And there's this other term, mentalization, and both of these words are critical when we're talking about attachment and the attachment dance between a child and their caregiver. So, what are they focused on? What are they thinking? What are they feeling in their body? What is their motivation, right? So
Hmm.
we're making when we're with other humans, we're making many, many millisecond snap judgment interpretations about
Yeah.
what somebody's doing and why they're doing it. And the ability to be accurate about that is based on our own experiences. So if you are going to attune to your child, you have to know that they need you to do that in that moment. And then you have to be able to put yourself in their shoes in a way that's accurate, right? So
Yes.
if
Yes.
what's really bothering my child is that they're overly tired and overstimulated, but what they're telling me is that they don't want their banana to be yellow, right?
Yeah.
They don't
Yeah.
need me to talk about logic, right?
Yes.
They need me
Yes.
to help them. They need me to stand closer. They need me to
Yes.
slow down.
Yes.
They need these different things from me. So many times parents are misinterpreting what exactly is going on in the first place. And so their solutions
Yes.
aren't landing.
Yes, it fits right in with what we talk all the time on this podcast about of especially with kids who have brains that work differently and their experience of the world is so different
Mm-hmm.
than we imagine. We have to start imagining. We have to learn what it means for them to navigate a world that's not set up for them and the
Right.
amount of distress that comes with those seemingly easy things that we would just fly through, right? Because we have the skills to do that and to be with them in their distress, right? So,
Exactly.
yes.
And here's this other kind of this, I mean, this is quite philosophical, but I think it's what I ground my clinical practice in, my consultation practice, and the way that I am with my own children is the goal for me is not to prevent pain for my children. And
Mhm.
I don't believe that that is preventable, actually. I think that
Yeah.
part of being a human in this iteration of how we're alive includes pain, right?
Yeah. Yeah.
But that they people can have companionship in their pain. And when they don't feel alone in their pain, then the pain is warm and it's
Yeah.
not lonely. And
Yeah.
that doesn't bring about as much suffering, right? That
Yeah.
actually is just a moment that's uncomfortable or upsetting. And then all of these resiliencies can come through when we don't feel alone in that pain. And then we can feel pretty happy with how we coped with it. And if the pain feels isolated and cold and lonely and dark,
Yeah.
that's when the suffering comes. And
Yes.
clinically,
Yeah.
like that's when the symptoms come, right?
Right. It's so, I mean, as you're talking about that, I'm like, yes, 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 for our kids, but for the parents that I work with too, right? I mean, it's part of their experience too. So that attunement, that being with the mentalization that you talk about,
Mhm.
that all makes sense. And it sounds like what you are, the way that you think about it and talk about it is that in order to do that, in order to attune, you need the motivation, awareness, and resources. Is
That's
that the
right.
right connection?
That's
Okay.
right. So
And so
you have to want to meet them and you have to want to say like, "Oh, I want to help my kid," which most people do, you know?
yeah, so here's an interesting question, and we didn't I'd be interested to hear your thoughts on this.
Yeah,
I have parents who come to me for help, and so they're clearly motivated. I mean,
that's right.
they're spending time and resources, but what I can see is that they are in the depths of burnout.
Yeah.
And they're desperate for things to be better in their home, which means to have their child be less challenging, but
Mhm.
the attunement is still really, really difficult.
Yeah.
And I don't know if that's about, I mean, I would imagine it's kind of a mixture of the internal resources are completely depleted, right?
Yes.
But for a very understandable reasons.
Yes.
But is that a motivation thing too in the way that we're talking about it? And it's not a judgment of them. It's because they are in this place of burnout. Or how would you talk
I
about
would say the motivation is there. The
that?
fact
Okay.
that they're
Okay.
coming to you in the first
Yeah.
place is, I want this to be different, right? And
Okay.
I know that I'm the one that needs to pull something into this family system to change it, you know? The
So I
fact
want
that
folks to hear that because what I think is hopeful about that is that if you are a parent who feels so burnt out that you're like, I don't like parenting.
Mhm.
I don't even know if I like my child, but I'm motivated for things to get better. And I know that I'm going to need to do something about that. I'm going to go meet with someone. I'm going to get my support that is enough for that
That
motivation
is
piece.
enough.
Yeah, great. I just wanted to clarify that piece.
I just also wanna say to all those parents, we're not built to do this solo, right? Like, the anthropological research, sociologically, we're
Yes.
supposed to, like, in a more traditional, less industrialized, individualistic society, it's 4 adults around 1 child
Yeah.
at all times when you're
Yeah.
in a
Yeah.
village system with grown-up cousins and aunties and neighbors and lots of siblings and this other way that we used to do it. And so that's what really our nervous system is built for, is not being the point person all the time, not
Yeah.
being the cook and the security blanket and the conflict manager and the driver and all the things that we are.
Yeah.
So
Yeah. Oh,
for
it just
burnout,
reminds me, I'm still having conversations with parents about their experience of COVID, for especially solo parents, but even two people partnering, parenting together. Just even how more isolated that was and why we're still talking about their experience of it because it was so traumatic, right?
yeah.
Yeah.
And even
Yeah.
post-COVID, we're just nobody is assuming responsibility for anybody else's dinner unless
Yeah.
somebody just had knee surgery. It's just we're very, very siloed in our
Yes.
society all the
Yes.
time, even if it's us and our partner. That's still not enough people. And
Right.
then you throw neurodiversity into it, and now you really burnout is to be expected. It's
Right.
it's not from not being good enough that you're burnt
Right.
out, you know?
Right.
So it's definitely not a motivational. I think anybody who's tuning into this to listen or coming to you for help is motivated.
Yes. Yeah.
And really it's that place where parents get where they have a moment where they're like, oh, I want to do better. I wish I didn't say that.
Yeah.
That's the motivation.
Yes.
That's the
Yeah.
love and the motivation piece ringing through even for, I think, the most burnt out parent.
Yeah. Okay. Great. So that's motivation, awareness, and resource. Can you say a little bit more about those two?
Yeah. So awareness is one where I think that's a really big lever that us as helping professionals like lean on right away, right?
Mhm.
Psychoeducation
Mhm.
and giving a book that says like, did you know that a 6-year-old or a 4-year-old, it's normal for them to do this, this, and that,
Mhm.
that it's not to be, to have age appropriate expectations and to
Mhm.
shift like, oh yeah, they just can't really do that yet,
Yeah.
right? That most kids get much, much better at sleeping after age 6. When I tell a very tired parent of a 4-year-old that, they're like,
Yeah.
oh, really? And yeah. And we can point to some research for that. And that can really change things because there's just a different
Yes.
awareness, right?
Yes. Yes. I call it a shifting of the lens.
Right. Exactly.
Yeah, that's 95% of my work.
Exactly. Right.
Yeah.
Right.
Yeah.
And so if somebody is coming from a very, their own childhood experience of things being very authoritarian and strict, where it was sort
Yes.
of like, children should be seen and not heard, spare the rod, spoil the child, sort of smile and tuck all your emotions in and make it nice. Like that's your job as a kid is to like, don't make things fussy and hard. Then their awareness can be skewed in terms of what a child is really capable of or
Mm.
what is required in order to meet a child's needs because it's
Yes.
never been modeled, right? So
Yes.
it's like, well, if I've told them 3 times, they should know, right? So offering that shift of like, actually, if you tell them once while you're touching them, that might be more effective than telling them multiple times from across the room. That's just an awareness shift of like,
That's
oh,
right.
could do it that way, right?
That's right.
So that's the awareness piece, right? You don't know what you don't know. So sometimes you feel like the narrative can be when I'm working with parents, like, well, I'm doing all the things. I've tried everything
Yes.
that the thing said, but until we're talking situationally and in examples, we
Yes.
kind of don't know where the awareness can be increased.
Yeah,
Right.
exactly, exactly. I mean, it truly is. It's yes. I find it too with parents who maybe they have multiple children, most of them neurotypical, one that's not, and they are doing pretty well with the
Mhm.
neurotypical child because that child is the attunement is easier, right? It kind of meets their ability
Mhm.
very nicely.
Exactly.
But then you have a child who struggles behaviorally with these symptoms, with these lagging cognitive skills. That's where the awareness of like, oh, this is a whole different ballgame here.
That's right.
They need a completely different type of understanding and parenting, right?
Right.
Than this child. So that awareness piece, I think the listeners will resonate with them strongly because that's really what we do a lot
Yeah.
of on this podcast. Yeah.
One of the pieces of awareness that I feel like it's important to talk about for your listeners to really hear is so much of what motivates us as parents is fear, right? And
Hmm.
the internal dialogue sounds like, well, I don't want my child to grow up thinking that they can, or
Yes.
I'm not going to let somebody in my family do this to
Yeah.
me, or, they can't just keep doing that. That's not how the world works. Like
Yes.
these comments, that's actually fear in a
Yeah.
person's body, right? And so to understand, to have the awareness that the first thing and actually the most powerful thing and something you don't need your kid to be on board with in order for it to work is to actually soothe your own fear about that, right?
Yes.
And to try to hold the picture in your mind of this person that you're raising with so much love that you're pouring so much into is going to be a good person in the world.
Yes.
And they're going to
Yes.
give you the hardest time of everybody. But out there in
Yes.
the world, they're probably showing up very differently. They're showing up in many ways, as much as their capability allows, in the ways that you model, not in the ways that you want to try to punish, reinforce, explain. coach. It's really more going to be what they experience from you. So I think that just recognizing when fear gets churned up in an
Yeah.
individual's body and intervening with yourself before you say anything to your kiddo makes
Yes.
all the interventions more effective.
Yes. Yes. Oh,
Yeah.
I'm so glad they're hearing all this from you. They get tired of hearing it from me, I'm sure. I talk about when fear drives our behavior, when fear determines what we do next, nothing good happens.
Right.
Right?
And
That's where things get even harder.
yeah.
So, yeah.
And from a if we're thinking about our own psychology, the way that we protect ourselves from feeling fear is not one where we're concerned with attuning to another person. We're
Mm,
actually in that moment we're concerned with attuning to ourself
mm,
and protecting ourselves from this much distress. And so the experience, and I've talked to a lot of my adult clients about this, of like when enough activation happens for a parent, the kid can kind of feel the parent leave.
mm.
Right, because now they're dealing with their own internal structure.
Yeah.
They're not
Yeah.
thinking, "What's going through your mind?" "What
Yeah.
what are you tuning into right now?" So this
Yes.
mentalization and this attunement, we can't do it very well when we're really activated with our own fear. So
Yeah.
this self-soothing is really kind of the first step to anything that's being suggested in a parenting book.
Yes.
Right? Around,
Yes.
like,
I'm so glad
connect
you
and then
mentioned that.
redirect and all of
Yeah.
those really useful, very valid things don't work if when you connect, you're all frazzled and scared.
Right.
Mm.
Right, yeah. Yeah, so that I think would lead to resources, right? Because
Yes.
what you're talking about is in that situation are the internal resources, like the ability to recognize when fear is driving your behavior, that visceral response is starting to come to the surface, and how do you self-soothe? Like that would be an example, I imagine, of what you're talking about with an internal resource.
Absolutely. How do you self-soothe? How do you learn yourself well enough to understand when you feel fear, to even recognize that that's what it is, or be able to tolerate looking inside? Because
Yes.
many of us have been worked really hard to actually not look inside and work
Yes.
on producing and functioning. For many people, when they're activated, their best coping skill is to actually look outward and overfunction. So when we try to do that with kids, when that solution is to then get more of a heavier management style over our child in order to regulate ourselves, this is when we really start to have looping and power struggles.
Yeah.
And so the internal resource and resource in general is so important. One, it's where things like from my social work perspective, it's like, how much respite do you have? How
Yeah.
is your co-parenting partnership? How much sleep do you get? Like dealing with the external resources is so critical. But the internal resources often are based on intergenerational history of trauma,
Yes.
right? Big, big, big deal here.
Yes.
Um, and this
Yeah.
is you and I have talked about this, like
Yeah.
parenting, the metaphor I use, it churns the earth, right? And so maybe we have some coping skills that worked very, very well before we had children, to recover from our aversive experiences from childhood.
Yeah.
We know how to distract ourselves in many different ways, some pro-social, some not pro-social and not healthy, but we've learned how to cope, right?
Yes.
And
Yes.
then here comes this beautiful child and this unbelievably intense experience.
Yeah.
And all of a sudden, it kind of can bust up the system that worked so well. And
Mhm.
now we find ourselves sitting with old grief that we hadn't looked at in a long time,
Mhm.
old fears and triggers from unmet needs, from
Mhm.
traumatic incidences from our past that we're now because we relive our life through our kids' lives. I think for a lot of families that may be listening to this, you maybe, have had a diagnosis that your child has been given. You're realizing that there's something that's not neurotypical or
Yeah.
their own trauma history. And there's all the ambiguous grief that's going to come
Yes.
along with the fact that you realize your parenting journey is not going to be what you imagined it was going to be.
Yes. Oh my gosh. Well, at the time of this recording, the last podcast episode I did was on grief. in this parenting experience. And I've heard it's probably the podcast that I've heard the most feedback, like direct feedback on from parents, but it's about that disenfranchised, ambiguous grief.
Yeah.
The piece, and I know we're I've had you here for a long time, but I want you to be able to talk to this because this was really powerful for me when you talked about this in the EMDR training I did with you, where I think when we talk about traumatic childhood experiences or histories, people have a sense of what that might encompass. But there's this other set of parents who didn't have that, or they don't identify with that, but they had an experience that was like, I think of it as like void of attunement.
Exactly.
Right?
I was just thinking that.
Yeah. And they don't recognize that. And when I've been able to highlight that for that group of parents, and I'll have you explain what I'm talking about here because you do it so much better than I do. They're like, oh, okay, that's why this is hard for me. Right? They discount it at first because it's like, well, my childhood wasn't traumatic. But it's like, okay, so it wasn't traumatic, but it didn't include this. How was, so it seems like you know exactly what I'm talking about.
Yes,
if you could talk a little bit more about that grouping of parents.
Yes. When I take a history, I think all of us therapists, we ask, what was your childhood like? What's your relationship with your parents and your family of origin like? And for many people, they will say that it's great if there was no big trauma. Nobody was hit. Nobody died unexpectedly. Nobody went to war. Nobody was they had all of their material needs met. They, had a stable school and they had food and clothing. And boy, if their parents stayed married and if they're still talking to them regularly, that's when I'm like, I have a great relationship with my parents, which they rightfully do. But when we're really thinking about attunement and then how we're fed and given a model for them to meet our child's needs, questions like, when you came home from school, if you had a rough day at school, who would you talk to?
Yeah.
And those same individuals will say, oh, well, nobody. Like that. My mom would have freaked out. She was such a worrier, and then she would have, if I was going to say anything, then she'd call my teacher and she'd call my friend's mom. And so I didn't tell her things. Or, oh no, my mom had so much on my plate with my brother. I never told her anything. I just tried to get straight A's and not rock the boat, and so now we hear about these nuances of how parents were not emotionally available.
Yes.
Again, and this is where I kind of started talking about those 3 prongs of parenting. That can be a hard thing for people to recognize because they love their parents, because they have held a narrative for their whole life that their parents are good and have done a good job.
Yeah.
And this isn't to discount that, right?
Yes.
This is just to
recognize. The both and.
Right. This is not that this is to recognize that if they didn't have those 3 things, resource, awareness, and motivation, they couldn't meet their emotional needs.
Yes.
And if you have 10 siblings, guess what? Your parents don't have as much resource for you.
Yes.
Even if they have all the motivation in the world. If your parents grew up incredibly poor in a very devout religious place that had military occupation, they probably don't have a lot of awareness around what the value of meeting emotional needs is because they grew up in a place where they were just thinking about survival.
Yes.
Just thinking about everybody having food.
Yes.
So when we're looking at our own internal resource, we have to look back at our own story and our own attachment with that same lens of awareness, motivation, and resource so that we're not blaming anybody for failing us. We're not saying anybody was bad. Just like when we make a mistake with our kids, it's not because we're bad and it's not because we're forever damaging them. But we can take a look at, okay, what is actually happening when in this moment I can't connect to all this beautiful knowing I have when I'm calm.
That's right. That's right. I think it just leads to a lot more capacity for self-compassion and also reflecting on our parents' experience with a lot of compassion. As there's a reason why they were under-resourced, right?
That's right.
It's that intergenerational patterning. But yeah, I'm so glad that we took a moment to talk about that because I think the way that you described it was like physically available, but emotionally absent or something, or emotionally unavailable. And I think that's a really common, strong pattern. So highlighting that for folks. Okay.
And it doesn't mean that
EMDR.
they weren't affectionate. That's the other
Okay, say
confusing
more about
piece.
that.
It
Yeah.
doesn't mean that there weren't love and getting tucked in at bedtime and getting your owies kissed. It means that when you felt anxious or when you were out of patience or when you were having a temper tantrum,
Yeah.
that was considered like pull it together or go to your room and
Yeah.
figure it out and come out when you're calm. It's not that
Yes.
there wasn't loving care, right? It's
That's right.
another level of this thing we've been talking about around attunement.
Right. Attunement specifically in the distressing moments,
Yes.
which is, yeah, really, really
Right.
hard.
Oh, we could
Okay.
talk about this for hours
I
and
know.
it's not enough time.
I know. You may be my longest episode so far, which is great.
Anybody
Um,
who knows me would be like, of course.
I know. I want you to be able to talk about EMDR and how that ties into your work with parents specifically, because you have such a depth of knowledge in EMDR. You've also worked with parents. And, with the clients that I do coaching with, I'm like, I think EMDR would be helpful for you. That's
Mhm.
often a referral I make with my therapy clients in my state. It's something that I love to explore with them. So if you could just give folks information on why it is so powerful, why they might
Okay.
consider it.
I'll be so concise about this because we've really been talking about it the whole time, right?
Yeah.
That it's a neuroaffective intervention. So your neurology connecting to your emotional, psychological life, right? So it essentially is providing the bridge between the moment of trigger where you are totally scared and totally angry and totally overstimulated and you aren't able to touch into all of this wisdom and knowledge you've gathered around what kind of parent you want to be.
Mhm.
And when you do EMDR therapy, it heals the origins of the triggers that are getting woken up and allows a bridge into the prefrontal cortex where your awareness and your patience and your compassion and your healthy adult perspective live. And
Mhm.
so a lot of people realize that something is getting triggered for them. Like, for
Mhm.
instance, I had a parent who was bullied in high school
Mhm.
and was part of a certain social clique, like that
Mhm.
was, she was a cheerleader and things. And then her child was part of like sort of a very different group in high school. And so when
Mhm.
they would have conflict, it would activate like those kids teasing her
Mhm.
at school. It was
Mhm.
very much not about her and her daughter. It was a
Yeah.
childhood experience. And it was like, you may not speak to me that way,
Yeah,
which
I will not be
with
bullied again.
adolescence,
Yes. Yeah.
we're not going to get far if we're trying to take away all the sass and the attitude. This is developmentally appropriate time to kind of be a little spicy to your parents. And so she could understand that cognitively, but in that
Yes.
moment, it just felt like she was being victimized.
Yeah.
And
Yeah.
when we reprocess those kinds of memories, that goes away. That really can go away and be resolved. And the adult perspective can be there like, oh, this is my 14-year-old whose brain isn't fully built
Yeah.
having an emotional moment all over me.
Yeah.
And it's ridiculous. And all I need to do is stay calm. And it's going to pass
Yeah.
in 15 minutes
Yeah.
because it's not based in anything logical at all, you know? And so EMDR therapy is the type of thing where somebody can go from feeling very helpless in those situations to
Mhm.
staying in touch with the knowing of like, oh, all I have to do right now is stay calm through this moment. It
Yes.
can be really a game changer.
Yeah, it really can.
Yeah.
So that's one piece. Can you talk again, just briefly, about how it can help parents who have experienced trauma in their parenting
Oh,
experience
yes.
because of the behaviors like rage for hours,
Yeah.
throwing things, destroying property,
Yeah.
punching holes in the walls, like the recovery from that, how it can be used for that too. Because I want folks to understand it's not just about traumas that happened in childhood. It can be used for more current or present, even present traumas.
It's even more robust. If you have had a lot of your needs met as a child and your trauma that you're dealing with is from adulthood,
Mhm.
EMDR therapy is an even more robust intervention.
Yeah.
And so when we target what happened and the way that was the sensory experience of that, the noise and the fear, the way that that's held in our limbic system in terms of a felt sense in our body and the fight or flight system being activated.
Yeah.
We target that with EMDR therapy. That way of holding the memory changes forever. And it becomes sort of similar to how you would think about like what you had for lunch yesterday.
Yeah.
You don't retaste the food. You don't feel full in your belly. You just can think from a very kind of narrative place of like, oh, that happened.
Yeah.
And so we are able to target those really sometimes volatile and frankly traumatizing. Like trauma is anything that overwhelms you and you continue to have an overwhelmed response to it after it happens. So it's an incredibly powerful intervention for parents who've had that happen in their home with their children.
Great. I'm so glad we took a few minutes to talk about that because I want folks to really, if that resonates with them, to explore those resources. So, Wendy Sue, thank you.
Yeah, thank you so
I might
much
have to
for
have you on
having
for a
me
part
on.
2. We could
Absolutely. Okay. My kids found out that we were talking today and they thought since it's a parenting podcast that I would be talking about them. And I just promised them that I would say, hi, Milo. Hi, Penelope.
Yes. Awesome. Have them listen to it later.
Yes. All right.
Where can folks who are listening learn more about how you can help them? And again, professionals in the work that you do, parents, if you're still taking new clients and where they need to live and how you do that. Anything that you want to share about where people can find out all of the wonderful things you do for them?
I have a website, EMDRresourcecenter.com. And you can go when you land there, because I do so many trainings for therapists on providing EMDR therapy. That's kind of what the landing page is. But there's a page for parents.
Yeah.
And so you can go to the menu and look for parents. And I do parent support consultations. I provide EMDR therapy for parents. I also provide consultation and training for therapists and professionals who are working with parents and working with children, providing EMDR therapy. And I'm licensed in California and Oregon. So I work in person in Oregon, in Portland, and then do virtual stuff in California.
Awesome. I'll definitely link to that resource in the show notes so people can find it there as well. Wonderful. Thank you so much for your time. I love talking with you.
I know,
so
it's
glad
really
we did
so
this.
fun. An excuse to spend time together too.
That's right. That's right. Okay. Talk to you later.
Bye.
Bye.
Hey, if you found today's episode helpful in any way, I'd like to ask a quick favor of you. And that is that you take just a moment to share this episode on Instagram or Facebook, the 2 places where I hang out most. By doing this, you will help me reach more parents who are really needing reassurance that they are not alone and that there is information out there that can help their family heal. Thanks so much in joining me in my efforts to reach them and support them. It is so appreciated.